Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen.
Welcome to episode 21, and this is part of our hair loss in women series. And we've hopefully followed us so far. We've introduced the concept of hair loss and hair shedding in women, and then we sort of unpacked female pattern hair loss, and we talked about the causes, the genetics, and the hormonal causes. But now what we thought we'd do is we'll start talking about I don't want to say treatment as much as management of this, because I don't think we can never fully treat female pattern hair loss. Because once the hair, in a similar sort of issue with men, once the hair is gone, it's gone. You're trying to stabilize that, and that's what we're trying to do with therapy. Be it medical or non-medical therapy, we're trying to stabilize the hair loss. So today what we're going to talk about is stimulation therapy.
Okay. So first thing, we can't cure it. Okay. So if people come in thinking they can take something for 3 months or 6 months, solve the problem and never have a problem again.
And we get that a lot, don't we?
They get asked that all the time. I'm sorry, that's not possible.
And we understand why you're asking, because
sure,
we know
you're hoping that you can deal with it and get it over and done with.
Yeah.
But we can't cure it. Therefore, we can only manage it. And so I say to my patients, it's a bit like having high blood pressure or arthritis. Nobody can cure these things. All we can do is manage them. And if you're unlucky enough to be in that category of getting the problem, then early treatment is essential, because as Vikram said, we're much better at preventing hair loss than we are in regrowing hair in women who've lost a lot of hair. Now, luckily, women tend to panic about this pretty early on. So we do see a lot of women come to us early in the condition, which is important, because once we've made the diagnosis, which we talked about by doing blood tests as well as clinical examination, once we've made the diagnosis, then it becomes about management. And the single most probably important thing that we're going to treat all of our women with is stimulation therapy.
That's right.
And what we mean by stimulation therapy is we're going to apply some technology to the hairs that says work harder, grow thicker, grow longer, stick around longer. Okay, that's the goal here. So it still means you're going to shed hairs, right? You've still got to shed hairs, because every hair in your head has to shed. But the idea is to get them as healthy as possible.
So we in our last episode we talked about the causes of female pattern hair loss. We talked about genes, and we talked about the hormonal causes. Now, and we said that treatment or management is targeted at that, but this particular, stimulation therapy doesn't. Okay, we're aware of that. What we're trying to do, we're not affecting hormonal levels or doing anything of that sort. What we're trying to do is just get a whip out and whip the hair into action.
Make them stay strong and long as is possible under the circumstances. So if we're going to talk about our stimulation therapies, the two principal ones we use are...
Well, we'll start off with minoxidil.
Minoxidil, which of course we've talked about with men before. This can be provided as a lotion, which you can buy over the counter at your chemist. By the way, it comes in two strengths, 5% and 2%. The 5% works quicker than the 2%. The women's one that says, it's
a 4% one, isn't it? Or
no, 5. So, if you see it in a pink box, it just means they market it in a pink box. If they don't have any pink boxes left with the 5% minoxidil, buy the blue one or the yellow one.
Most pharmacies just, I find people go around looking for the pink one, and you go, no, just use the. It
makes no difference. The colour of the packaging makes no difference to it. So I'm going to again be controversial and tell you that what's written on the box is wrong. The topical 5% minoxidil lasts 21 hours in the skin, and so Vikram and I only recommend people take it once a day, and that's perfectly reasonable. Now, it comes in two versions. It comes in a lotion, which has a kind of a slightly greasier feel to it, which some women don't like because it mucks up their hairstyling. Or it comes in a foam, which is less greasy. And again, some women don't like it necessarily because it still interferes with their styling options.
But the foam is a lot easier to use.
It's easier to use, and it also absorbs faster. So the foam absorbs in 10 minutes. The solution lotion takes 60 to 90 minutes. So there's a difference there as well.
So, and the other thing, just as a practical point, if you're using this, applying it to the hair makes absolutely no difference whatsoever. It needs to be applied to the scalp. The hair, as we talked about before, is actually dead. The actual bit of the hair that's outside the skin is actually dead. It's like rope. So actually applying any, minoxidil, for example, is not going to stimulate that hair. What you need to do is apply it to the scalp. So if you're using either the liquid or the foam, whichever one, but the foam is a lot easier to handle, squeeze a little bit into the cap. We just use your finger or a cotton bud and just apply it on the area.
Make sure it gets on the skin.
Yes.
So these are available over the counter at a chemist. Okay, so it's a chemist line. It's not very expensive. You can use the generic versions. You can use the official versions. It makes not a little bit of difference at all. So that's the way a lot of people use it. For the women that are having trouble using it like that, we sometimes will go back to prescribing it in an oral form. Okay, so the third way we give minoxidil out these days is in oral form. Now, we do it in a capsule because there is no tablet really that has the right dose in it for women. There is a tablet out there, but you've got to cut it down into at least quarters, if not fifths, which is really technically demanding. So under the circumstances, if you're going to use oral minoxidil and save yourself the hassle of applying it to the scalp, you can get it compounded at a compounding pharmacy, and they'll make it up into the dose. And so we use 5% in the solution, but in women we tend to use between about 0.5 milligram to 1 milligram of minoxidil per day, once a day as a capsule. That is very, very helpful. The sooner you start that, the better off you're going to be. The main improvement in using minoxidil is in the shaft diameter.
That's right.
The numbers go up a little bit. It's the shaft diameter. If you've got hairs there, you want them to be thicker hairs. And that's the best way we get minoxidil working.
So there's only 2 points I want to add to that as well. I think the first thing is we get a lot of patients, we talk them through this just like this, and they start on minoxidil and they come back and go, I hate it. It made my hair loss worse. And that's actually true, and you must be aware of that, because what it's doing is it's stimulating the hair to grow. And part of that stimulation process may be ejecting that existing hair that's coming towards the end of its cycle and a new hair coming back in its place. But as a user, what you see is, oh my God, I'm shedding more hair. This minoxidil is making things worse, therefore it's making me lose hair, therefore I'm going to stop it. And in those scenarios, you're getting more of the negative effects and you're not hanging around for the good effects, which are going to happen 3 months down the track. So you have to persevere. And we do warn our patients that there is an initial phase where they may notice a little bit of extra shedding.
Right, so typically this happens 4 to 6 weeks after you start the medicine. It only lasts 4 to 6 weeks, so if you can steel yourself to get through that phase, think of it as good hairs pushing out old, weaker hairs. It's a temporary phase that lasts about 6 weeks. And don't panic and don't stop, all right? The really important thing is to do it.
Yes.
Now, if you are going to stop after 6 or 12 months because you don't know whether it's working, that's fine. Because if you stop and then you go, oh my goodness, 4 to 6 weeks later, I've got some increased shedding, that tells you it worked.
Yes.
Okay, so it's quite acceptable to stop, and we sometimes ask our patients to stop
to see if it's working.
to see if it's making a difference. Because if you stop it and not much changes, maybe it wasn't doing much for you. But we do think that in terms of women, that we can increase their hair shaft diameters and their numbers, it's about a 50-50 play. Using it topically, that we can get improvement with them.
So that's true with both the topical version and the oral version. So some people ask which is better. It's which one you will take, which you got better compliance for. The thing I will say about the oral tablet as well, it has a more systemic effect, so you may notice hair stimulation everywhere. And
which is why we use a low dose to minimize that risk.
But you've got to be aware that that's the case, whereas with the topical version, it's going to act exactly where you've applied it. So that's something to be mindful of.
In our next episode, we're going to talk about laser therapy so that you can understand another way to do stimulation that doesn't involve chemicals. If you've enjoyed today, please give us a like or subscribe to the channel, and we look forward to seeing you next time where we'll discuss laser therapy.
See you next time. Thanks.